Hello, I am Dr. Pramod Bhor, joint replacement surgeon and orthopedic surgeon at Kharghar Medicity Hospital, Kharghar. Today on World Osteoporosis Day, I would like to speak about some the commonest disease I would say, that is osteoporosis. So osteoporosis, what is osteoporosis? So let us go to that first. Osteoporosis is basically deficiency of calcium and weakening of the bones. This is a major illness causing problems at an elderly age group, as well as, if I consider now, even at a younger age group, where it comes into a category of osteopenia. Osteopenia is a little bit a smaller version or a simpler version of osteoporosis, I would say. Osteoporosis is a severe deficiency, and osteopenia is a moderate deficiency of calcium. In whom do we see osteoporosis in common? So osteoporosis is again very common in an elderly age group. Definitely patients above 45, 50 and 60. 45 majorly females, any female after 45, they are at a high risk age group as compared to males whom we see after the age of around 50, 55. So in this last year or so, because of the lockdown and because of this thing, we are even seeing patients who have starting to, younger age group patients who are starting to have similar symptoms of osteoporosis, like bone pains and joint pains as well. Osteoporosis is a major so in those, why is that happening? So I would say that is happening basically because of the sedentary lifestyle that we have gone into. We are just sitting at home. We are majorly looking, even the kids are also at home. So because of the vitamin D deficiency and everything, they are starting to have some amount of osteopenia. So how do we treat osteoporosis? The treatment is majorly simple. The activity and dietary supplementation is needed. Dietary supplementation in terms of calcium, vitamin D is definitely the line of treatment. Calcium has to be taken regularly, once a day minimum, for the period maybe around 3 months, 6 months. You can take a break in between. Plus vitamin D regularly to be taken weekly or daily, depending upon the dosage. Because of the lifestyle that, as I was speaking earlier, the lifestyle that we have changes we have undergone in the last 1 or 2 years, we are not getting exposed to enough vitamin D. That is, we are not coming out in the sun, even because of the, you can say, the ozone layer and everything that has been because of the pollution. We do not get enough vitamin D. So definitely I would ask patients or people having bone pains to regularly take a dosage of vitamin D in terms of for preventing osteoporosis. So why is it important that we treat this osteoporosis? Because osteoporosis itself will not cause you too much amount of problem, but it is going to make your bones brittle. So even trivial falls, even trivial injuries can give you major fractures. So I have seen people coming to me that, okay sir, I just slipped a step, I just missed a step, and I have a fracture in my hip bone, and the patient is in bed for 3 months further. So even if I operate, I fix the fracture, till the fracture unites, the patient has to recover slowly. I make the patient walk on day 2, but he is walking with a walker. To leave the walker and completely go on to your lifestyle, it takes around 2.5 to 3 months for an elderly age group patient. So patient should take care to prevent osteoporosis, because this kind of trivial falls or this kind of, you don't want to have fractures which are very trivial. Even patients have spine fractures even without a fall. Even I have seen patients coming to me who have just jumped a speed breaker and they have fractures in the spine because of osteoporosis. So it's very important that this major illness should be treated regularly and it should be recognized rather. We do not recognize it because we recognize joint pain, we recognize arthritis, we recognize fractures, but we do not recognize osteoporosis as an illness. We just think, yes, it is one of the symptoms, but osteoporosis is one of the major illnesses and it should be regularly treated. Treatment is simple. We have to strengthen the bones. Strengthening is simpler by only taking 2 medicines. That is, I wouldn't say medicines, it is basically a dietary supplementation, not medicines. So basically take a proper dietary supplementation of calcium and vitamin D. Strengthen your bones by regular activities, regular movements, and prevent osteoporosis. So prevention is the main treatment of osteoporosis. Kindly prevent that, and so that you don't have to face major illnesses like fractures or arthritis. So take care. Thank you.